Hello and welcome to Wilson Center Now, a production of the Woodrow Wilson International Center for Scholars. I'm John Molesky. My guest today is Anya Prusa. Anya is the Slater Family Fellow and a senior associate with the Wilson Center's Brazil Institute. She joins us to talk about the dire circumstances around the pandemic in Brazil. Anya, welcome. Thank you for joining us.
Thanks for having me, John.
So why don't I begin with just a news blurb? What is the latest?
So the situation in Brazil continues to get worse. At the moment, more than 350,000 Brazilians have died of COVID-19. It's the second highest number in the world. And we've seen in recent weeks that the daily death toll is hit as high as 4,000 people a day for a couple days. And the averages are not encouraging, right? We're not seeing a significant drop off in the number of cases or the number of deaths. And this has really put the public health system and the health system more broadly across Brazil in crisis. And so it is a very, very serious situation. I cannot stress that enough. And for, those of us who have friends and family in Brazil, who know colleagues who are in Brazil, it's a really serious, scary time for a lot of them.
And beyond Brazil, again, we talk about borders, but the virus knows no borders. I can't imagine that the Bolsonaro government is popular with its neighbors, given the fact that things are spiraling out of control within the country.
Yes, we've actually seen statements by a number of leaders in the region, including, Nicolas Maduro and some of these others from countries like Venezuela that themselves haven't been highly successful at curbing the government, but even they are taking notice of how unchecked the spread of COVID-19 is in Brazil. I actually read that Uruguay is working desperately to vaccinate people who live along its own border with Brazil, right? To try to create this vaccine shield, if you will, to protect its own population from the spread of the virus in Brazil. They're doing temperature checks and quick COVID checks on truckers. A lot of the freight that is moving in South America between Brazil and its Mercosur partners, Argentina, Paraguay, Uruguay, it is by truck, it's by road. And so just trying to figure out how to make that sort of transit as safe as possible has been a real challenge, because you can't shut down the economy fully, right? These economies are linked. And so trying to figure out how to protect their own populations without creating additional economic harm.
When Nicolas Maduro becomes the voice of reason, we know that we're in some trouble. Speaking of leaders, with all silliness aside, from the start, Bolsonaro has downplayed this pandemic and has refused to take the kind of measures that have been successful globally. Was this almost an inevitability given the way that the government responded from the get-go?
I think the situation that Brazil is in right now, it is in many ways a real tragedy because it didn't need to be this bad, right? It's hard to say exactly how good or bad it would have been, but we certainly know that the measures that the government took, the measures that it didn't take, have contributed to the severity of the outbreak across Brazil. So Brazil really didn't prepare for the virus. Even once we saw it starting to appear in Europe, in the United States, once first cases were reported in Brazil, there was this attitude from the federal government that this wasn't going to be a problem. President Bolsonaro said on multiple occasions, this is just a little flu, a little cold, a gripezinha, that Brazilians were made of strong stuff and they would get through it. He told people not to be afraid. And he also very clearly said that the economy is the most important thing. So we're not going to, socially distance. We're not going to close down restaurants and shops. He made the choice to try to encourage people to continue to go out and participate in the economy. What we saw is that the really substantial response actually came from the governors and the mayors in Brazil. They were the ones who were actually imposing lockdown orders, who were telling people to wear masks. And this has continued, right? So recently we saw a really strict series of lockdowns imposed in Sao Paulo and a few other states in response to rising cases. And those have had some impact, right? We have seen, a slight decline. It's not worsening quite as much. The ICU capacity, they're not quite as full. They're at about, 70 to 80% capacity right now instead of 90%. So that is better, but it's certainly not good enough.
But undermined by the federal government's lack of support of those measures.
Mm-hmm.
So you talk about the ICU capacity. For weeks, we've been hearing that the system is about to break, that it's overloaded. Have we gotten there yet?
We have. I mean, if you look at reporting on the ground, if you talk with people who are, in the hospitals, experience the healthcare system, working in the healthcare system, they will tell you that it is at its breaking point, right? Sao Paulo right now is just a few days away from running out of the medications they need to do intubation, right? So to help COVID patients who need help breathing through respirators, right? They're going to run out of the medications that they need. There are reports of, people dying while waiting to get into the hospitals. Once you're in the hospital, there might not be a bed. So you're actually hooked up to an oxygen tank, sitting in the hallway, right? Sharing a tank with, multiple other people. So healthcare providers are clearly doing the very best they can in a really challenging situation. But I think it's so important to stress that they're managing to stay just, a couple days ahead of the demands in many cases for beds, for ventilation equipment, for oxygen. And in some cases, they're simply not able to. So we did see in Manaus in January, when the new Brazilian strain of the virus, the P1, first came to light, we saw that Manaus was completely overwhelmed. And in fact, several dozen people died of a lack of oxygen, right? They didn't die because of COVID-19. They died because they were unable to get the treatment that they needed to survive.
Tragic. It's just almost unspeakably tragic what's happening. What do we know about public opinion on you in terms of, there's been this tug of war between local and regional governments and the federal government. Has the public picked a side?
Well, President Jair Bolsonaro has seen his popularity fall in recent months. Part of that is due to the end of the federal government's stimulus program. So last year, the federal government was sending checks every month to help lower income Brazilians kind of weather the pandemic, not too dissimilar from what we've seen, here in the US or in other countries. But those checks ended in December. The government has started a new, smaller program in recent weeks, but again, it's smaller, it doesn't reach as many people. And so certainly part of that fall in Bolsonaro's popularity can be attributed to the fact that he's no longer seen as helping poor Brazilians in this way, right?
And does this have long-term implications for politics in the country?
Well, during the stimulus program, it did kind of raise questions about, maybe the need for a universal basic income in Brazil, or for expanding, more traditional cash transfer programs like Bolsa Familia. So I think, on the one hand, it did really open up these conversations, and it focused a spotlight on how vulnerable many Brazilian workers are. There's a huge informal economy in Brazil. And so these are people who, they aren't protected under Brazilian labor law. They don't have the same rights and benefits. They're not going to receive pensions or other retirement programs. And so I think that was really important, right? To see that discussion really gaining force within the public policy space. On the other hand, the emergency cash transfer program was unsustainable fiscally, right? You're looking at a country in Brazil where their GDP declined 4.5% last year, which was actually much better than many were expecting, in part because the government was pumping so much money out into the economy, right? It really kept the economy from declining further. But this is coming on the heels of years of economic stagnation. Brazil went through a severe economic recession in 2015 and 2016 and really hadn't recovered before the pandemic hit. And so there are a lot of concerns about Brazil's capacity to keep spending. Government debt is rising. It's about 80%, 90% of GDP, right? So really, really high for a country like Brazil. And this is one of the challenges as the government looks towards, passing its budget for this year and beyond, is how do you weigh the need to support people who are hurting, right? And the pandemic has it's caused unemployment to rise, incomes to fall. So how do you balance that against the need to make sure that the government is balancing its own accounts and not spending more than it can afford? Because you don't want to drive inflation, you don't want to drive higher debt. So it's a really, really complicated situation to be in. And the thing about an emergency stimulus program, John, is that it's in an emergency, right? It should be a short-term cash infusion to keep the economy going and to support people. That only works if you actually tackle the reason behind the emergency, if you tackle COVID-19, right? The reason people needed economic support was because they couldn't work, and they couldn't work because of the pandemic. But Brazil has not tackled the pandemic. So you're entering year 2 of the pandemic, and people still need this sort of emergency support that really should have been kind of a one-time deal.
So I'll do a plug on you, because part of your introduction could have included that you're also an executive producer, a co-executive producer, and one of the panelists on a podcast called America's 360 that I'm also a part of with many of our colleagues. And in an episode coming up, maybe by the time you see this video already recorded, Anya will be doing more analysis of the impact of the situation on Brazilian politics. And you can find that when you come to the Wilson Center. If you check under the Watch and Listen tab, you can find America's 360. So to hear more, how's that? I did a little shameless self-promotion for us.
Sounds
so
shifting
gears back to the medical side of things, and some of the things we've seen, you mentioned the variants, which are causing huge concerns around the globe and are causing young people to become infected at a higher rate and sicker when they are infected. And we even talked before we began recording about the fact that tragically in Brazil, we've even seen the death of infants. Is there any scenario where the country is starting to get a handle on this, or is this really a runaway train?
So there was a report that came out earlier today, I believe, actually, from one of the country's foremost medical institutes, Fiocruz. And it said that at least for the month of April, we're going to continue to see, case counts at the levels that we're seeing right now. It's not going to get better. For what happens after April, looking at May, June, July, there's a number of factors at play, right? One of them is vaccination. And Brazil, although it possesses enormous capacity and institutional knowledge when it comes to mass vaccinations, they've actually, done this in the past, vaccinated, 1 million, 2 million people a day. They can do this. And they have, in fact, achieved similar levels during this pandemic in recent weeks, but the country just doesn't have enough vaccines, right? So if they had the doses, they could administer 2 million doses a day and get on top of this pandemic, you would hope, within a couple months. But there's been a real struggle to actually get the doses into the country.
Are they part of the COVAX program, or are they on their own in purchasing?
They are. So President Bolsonaro signed Brazil's request to the COVAX facility in March. So they were rather late to the game, but they did get the first delivery earlier this month of a couple million doses. And they will get enough to cover about 10% of Brazil from COVAX, right? So it is something. The country also is negotiating agreements with Pfizer and with Johnson & Johnson. But Brazil had invested early on in AstraZeneca and a couple other vaccines that have been really slow to come to market. The AstraZeneca in particular, they were manufacturing, or they were supposed to manufacture in Brazil, but it's actually been really hard to import the reagents that they need because other countries need them too. And so there is this real difficulty. You're competing against countries around the world who are facing similar crises and understandably trying to protect the interests of their own populations.
Yeah, I suspect in a month or two, this conversation is going to shift primarily to the notion of hoarding, because some countries, like the United States, have an overabundance of doses.
Yes. And Brazil has actually petitioned the US for some of the doses, some of the AstraZeneca doses that the US currently has, because obviously AstraZeneca is not yet approved in the US.
But we have the stockpile. Anya, thank you for this overview, and really thanks in particular for something you mentioned earlier about friends and family in the region. Because when we talk about these things from a safe distance, I can't help but be haunted by the fact that there are people dying as we speak, and it's more than just distant analysis. There's a human element to this that we just don't want to forget. To the contrary, we want to put front and center. Before we close, if you don't mind, I'd like to shift gears. People will be first seeing this interview during the week of Earth Week or Earth Day. And you just came away before joining us for this Wilson Center Now recording session from hosting a panel on the Amazon and on climate change in Brazil. Could you give us a quick summary of that? And then I can direct people to that full program if they'd like to see all of it.
Yes, so we were lucky to be joined by two state cabinet level secretaries, one from Amazonas and one from Pará in the Amazon. And they really discussed how important it was to bring in local voices when you're having these global climate negotiations. Obviously at the summit on April 22nd, it'll be heads of state, right? So President Bolsonaro, President Biden, presidents from other countries around the world. But when you're talking about something as complex as the Amazon, where you have 25 million residents in circumstances ranging from large urban industrial cities like Manaus to small fishing villages or subsistence farming, it's incredibly important to not just have the national, international level debate, right? But to actually include the voices of the people who have to make it work. So including Indigenous activists, including state level governments who are responsible for the well-being of their residents. And to also broaden that conversation. When you talk about an issue like deforestation, it is fundamentally intertwined with questions of development and poverty, access to resources. We talked a little bit earlier, John, about the COVID-19 crisis in Manaus, and that also is linked to these questions of sustainable development. And how do you make sure that in a region as rich and biodiverse as the Amazon, the benefits of that go to support local populations and do it in a way that is sustainable in the long run. So our event really examined, how do you change development pathways to make them benefit local populations as well as the Brazilian economy? And I think that's a really, really important question.
And if you'd like to watch that event, you can find it by coming to wilsoncenter.org and either clicking on the events tab and looking at past events or directly through the Brazil Institute links. Anya, thanks for joining us today and for giving us an update on, as it turns out, two topics.
Thank you for having me.
We hope you enjoyed this edition of Wilson Center Now and that you'll join us again soon on. Till then, for all of us at the center, I'm John Molesky. Thanks for being here.